Benign prostatic hyperplasia is the enlargement of the prostate, a common occurrence for men over 50. If left untreated, in some cases it can lead to irreversible bladder damage. The most common surgical treatment has the risk of side effects and long recovery periods, which can be off-putting. However, there are alternatives. Teleflex manufacture the UroLift System, which offers a less invasive treatment and shorter recovery times. We find out why this may help to encourage more men to seek medical help.
For many men, an enlarged prostate can present symptoms which are both uncomfortable and embarrassing. And for Gary Keane, these first started 10 years ago with an unexpected and urgent need to urinate.
You're looking for excuses all the time to use a bathroom, and then when you go on long journeys, if you're going on an aeroplane, going in the car for a long time, you're thinking to yourself, am I going to be able to make it? Everybody says, oh, what's the matter with him? Oh, he's got a weak bladder, he's just getting old, sort of thing. And it becomes a bit of a joke with some people, but it becomes embarrassing for the person themselves.
Benign prostatic hyperplasia, or BPH, is, as its name suggests, benign and unrelated to prostate cancer. But more than 40% of men in their 50s and more than 70% of men in their 60s are affected by it. So what causes BPH?
The prostate is a small gland about the size of a walnut and is located below the neck of the bladder. The urethra runs through the prostate from the bladder to the penis, allowing for the normal flow of urine out of the body. But as men, when we get older, the prostate can become enlarged, and when it does, that can cause problems and obstruct that normal flow of urine.
The commonest symptoms are, firstly, the symptoms where it's causing obstruction of the bladder, so that will slow the flow down, a poor stream. It'll give a thing called hesitancy, so men get to the toilet and they can't get started. As they're going, the flow can be quite intermittent, and it can also take a long time to finish. Also, enlargement of the prostate can start to irritate the bladder, and so that can then cause some bladder symptoms like going more frequently, getting up in the night to pass urine, and having increased urgency.
GPs are generally the first port of call for men who want to discuss the different treatment options with a healthcare professional. These can include what's known as watchful waiting, with simple lifestyle changes, a range of medications and surgical procedures. One option is the UroLift System. It's a proven, minimally invasive treatment for BPH. Small implants are placed to lift and hold the enlarged prostate tissue out of the way to decrease the obstruction of the urethra. The majority of patients will experience a quick recovery and a rapid improvement in symptoms.
In the past, that would have been major surgery, an operation called a TURP or TURP, which involves cutting out the prostate from inside. But more recently, we've had the introduction of these minimally invasive technologies, often available as a day case procedure or even sometimes under local anaesthetic, which offer men another option. It sits somewhere in between medication and major surgery, and so for many men this can be a really good option.
Despite living with BPH, Gary still enjoys a full and active life, and his advice for other men experiencing similar symptoms is simple: don't ignore them and seek help.
Get a consultation with your local doctor, tell him exactly what's going on, don't try and beat around the bush, and get checked out just in case. Hopefully everything is always going to be good, but there's so many alternatives now that are available for this sort of condition. It's definitely worth going to see the doctor and break that taboo.
I'm used to talking to men about these problems. It doesn't embarrass me one bit, and I would much prefer men to come and tell me openly and honestly what's going on, because then we can try and help them. I think the worst thing is if men are so embarrassed that they don't really reveal the impact the symptoms are having on them. It makes it so much harder to help. So I just really encourage men, don't be embarrassed, just come and talk to us. It's normal.